All right, say it again. Maybe it was me. Can you guys hear me?
Yeah, those of us that are here, I think. I don't know
Okay.
who's here.
Yeah, there's a couple people having trouble logging in.
I can hear you. Yes.
Okay, great. All right, yes, I see 7 of you are on. So we'll see if others arrive. So what's how's things going with the lab? How are you guys feeling about the exam? Are you doing both lab and lecture this week?
Some of us are, yeah.
Okay. Because I know there was confusion about there was questions about the consistency between the videos and the student lab notes.
A little bit, but I think it's been clarified. I don't
Okay.
know.
Yeah, because I looked at the video. I'm not really, if you were talking about the 8th edition on Canvas, I looked at the video and then I looked at the student notes and everything seemed to be that 10 centimeters. And then, you know, when you use the metronome for what tests. So
When we were, the videos we're referring to are it's the email that was sent out with after we sent in our voucher, we got a response email with like links to Kahoot, Quizlet, and it had some links to some videos. Those 2 videos are what we're referring to that are different than what we're being taught. On top of that, the curl up test in the book states that you're supposed to use different measurements depending on age. Whereas in our notes, it's saying 10 centimeters no matter what.
yeah, 10 centimeters is the correct. That's what you'll be tested on. Okay, so you place the tape, you know, either on both sides of the, you know, of the person or on one side, and then the person lays down with their fingers on the first tape, and they have to reach 10 centimeters to the second tape.
Okay, perfect. Thank you.
Well, I do have a question when it comes to the step test. Do you think they're going to make us do like the math portion? We're being taught to do the 3-minute step test and then have them sit down, record a 10-second rating, and then give them a minute and then record it for that minute.
So it's all about the recovery. So you're supposed to instruct that person at the very beginning of the test that, you know, what the protocol is. And then at the conclusion of the 3 minutes, if they complete it, they're asked to just sit down, not to say anything, and then, you know, measure their recovery heart rate.
Can I ask the question as far as the step test? The way we learned was that they do the 3-minute step test. Then you take their pulse for 10 seconds, and then they sit down. You have to do the math.
That's what you're learning in the lab?
Yeah.
But she's also a new instructor, and that's not what the book's saying.
Okay, here's what I'm gonna say, guys. Follow the book. That's what you're being tested on. The step test is there to test recovery, how quickly somebody recovers back to not resting levels, but near resting levels at the after sitting down for a minute. Okay.
But if we follow the book, the curl up test is incorrect then at 10 centimeters.
Are you talking about the current
The current 8th edition book states that depending on age, you change the measurement from 10 centimeters to maybe a shorter distance or a longer one.
All right, and is this the lab book or is this the textbook?
This is the textbook.
All right, follow for the lab stuff, follow the lab book.
Okay, so the notes that were sent out to us.
Correct.
Okay.
Okay, for the lab, because if you have a discrepancy, that's what you're going to argue is the lab manual. Okay, so for the lab, follow the lab, and then you have the textbook and all of the notes that we sent you for the lecture.
All right, so I'm assuming then we have them sit and then just record for 1 minute then.
Correct. All right, follow what's in the lab for the lab.
Now the teacher was unsure because this is her first time, you know, with WITS. Are they going to make us do math? Because we're only allowed to bring our phone, I believe, for metronome.
Yeah, I mean, anything that they need you to do, they will provide the material for you.
Okay.
So if there's something that you need to do mathematically, you know, need a calculator, you know, they'll probably either give you a calculator or they'll allow you to do the calculations on your phone.
Okay. Awesome.
Okay. The instructor is supposed to, or the examiner is supposed to provide you with all the resources that you need for the lab.
Do we need to take that 10-second, like right after they're done with the step test? 10 we're supposed to have them sit down, take 10 seconds, and then wait a minute and retake it. Do we have to do that 10 seconds?
In the lab book, what does it say? Somebody tell me what it says in the lab book.
I believe that what it's telling us to do is have them sit for a full minute and record it.
Correct. Okay, so there's a whole protocol at the beginning that you're supposed to be explaining to them. You're demonstrating the test, you're explaining exactly what the expectations are. Once they stop that 3 minutes, if they complete it, they're sitting down and you're going to monitor their heart rate for the recovery for a full minute. Okay? So whatever's in the lab book is what stands. Okay, so, you know, I mentioned to Jay that it was about the email that was sent out with those videos. I don't know what those videos are. I just know, you know, what's currently on the 8th edition because I created it. And when I've taught the lab, I've taught it the way it's written in the lab book. Okay? Does that help?
Yeah, that helps.
Okay, great. All right, so we left off at question 53, right? We finished 53, we were at 54, and I think that it went fairly well. I don't know if everybody here attended the first review session the Friday after 4th of July, but what we did was, you know, examine each question and, you know, not only for the correct answer, but why you heard me say correct, and then so in this case there are 4 choices, and how they refer to them is there's a correct answer and then there's distractors, and that's what those other choices are, to distract you. Okay, and then we also learned that there's parts of the question that we really need to hone in on to determine what exactly they want us to know and how to answer that question. Okay, so so let's kind of, you know, continue with that. Because I think that worked really well for you guys on the 5th. So we'll start with 54. And the question is, what is the primary storage form of fat in the body?
Triglycerides.
Correct.
B?
It's actually A, triglycerides. Okay, you're going to see that cholesterol is what's going to build up within, you know, the arteries of, you know, within the arteries of the body. So what I suggest in this case, just look up each of these terms, what triglycerides are, what cholesterol is, what lipoproteins are, and then what phospholipids are. And it'll give you a definition, and you can look. I think I showed this in the book. If you want to do a search, if you have the digital version of the text, you can actually put in at the top of the page or whatever page you're on, and let's say if I just put in triglycerides, okay, it's going to take me to where that is in the text and explain exactly what triglycerides are. Okay, and you might have to do some further, you know, looking into it a little bit deeper, but it takes you, in this case, it takes you to table 2.3, but it'll put you in the vicinity of where that information is. It's a little bit different. You know, you have to use the table of contents if you're using the glossary at the back, if you're using the hard copy. Okay, but now with the internet, it's very easy. If you haven't engaged with ChatGPT, real great for that. Okay, you can actually ask, you know, you guys have this exam, you can actually copy the question, put it into ChatGPT, and it will spit out an answer in terms of, or give you a definition for each of these. Okay, have you guys engaged with ChatGPT yet?
No.
Okay. Yeah, I mean, as I mentioned, I'm a professor at a college, and I'm also doing a lot of training right now with the professors because everybody thinks that AI and ChatGPT is, you know, going to replace them. But I've been using it a lot for workshops that I conduct, and you can actually put in this information. You could put the question in verbatim. It'll give you an answer. Like I put in, give me the, you know, the bones of the hand. Okay, and I can actually simplify it. If I wanted to say, could you explain it again, but on a 3rd grade level, it'll simplify it. Okay, so I would suggest that if you're struggling with some of these terms, try ChatGPT. Okay, I happen to like pi.ai. I think they're pretty good.
So it's
Okay,
called ChatGPT.
Chat GPT, but put in your browser pi.ai. Okay, you don't have to register for that. You can put your information in after the fact, but that I found for at least the phys ed, health and fitness field, it seems to work pretty well. Okay, so it's pi.ai.
Okay, thank you.
Okay, and you can create study guides right from there. It'll tell you that it may not be 100% accurate, but you can always look at your textbook at that point and do a comparison to see, or do additional research on the web, just to ensure that the information is generating that. But I have found it to be fairly accurate in terms of generating study guides. Okay. All right, let's go to 55. Which fiber type demonstrate a fast rate of contraction, high force production, and low fatigue resistance?
Type 2X.
Type 2X.
Correct. All right. And here's my question for you on top of that. Do we just, if we were doing an activity that it required all of that, would we just jump to type 2X?
No.
Correct. Okay. So remember, we start in order, right? Type 1, type 2A, type 2X. Okay. Type D is a total distractor, right? Type 2C. Do you guys remember learning anything about that?
No.
Right. So that's a distractor. Okay. The other two incorrect answers in this case are also distractors. But if you look at right away, we could eliminate that D wasn't even part of the part of one of the choices, because what's type 2C? Okay. All right, let's go to 56. In risk factor stratification, which type of individuals should be considered low risk?
A.
Correct. You guys did your work. All right, so high density lipoprotein, right? You've seen this HDL, right? Most people think, all right, high, it's got to be bad, but it's not. What's the bad one?
LDL.
Correct, right? Low density. High density lipoprotein is increased through exercise, and this person would be considered low risk if they have at least 60 as an HDL and a blood pressure, which would be considered low risk, and a blood pressure of 140/90. So I'm sorry, go ahead.
I was just going to say that blood pressure is elevated. Does the HDL cancel out the high blood pressure?
Yeah, well, because yes, it's definitely elevated. There's no question about it. But if you look at the ACSM guidelines, they went on to further. When I was studying, this would be 140/90. Yeah, absolutely. Yeah, I mean, it's a risk factor that needs a doctor's referral. But if you look at the ACSM guidelines, it tells you how many risk factors. So, right, HDL wouldn't be a risk factor. And so a person with one risk factor is not something that necessarily would be considered high risk, okay? If we get into some of these other choices, now we're talking about, someone that would be considered more of a high risk, okay? So
What
really
is
goes down.
normal?
I'm sorry?
What's a normal glucose level? Like, I have no idea what glucose levels are supposed to be.
Somebody
Yeah.
want to look that up? Look it up on your phone. What would be considered, I'll throw it back at you. What would be considered low, a good fasting glucose? Anybody want to look that up?
Isn't it 70 to 100 milligrams?
Okay, yeah, I mean, remember, everything in our industry is in ranges, okay? But then if you look at what would be, what they go based on with glucose, they go based on the A1C. So that's really where I'd be more concerned about, is what's going on with the A1C, as opposed to, not that you don't want to negate the fast glucose, but also if someone was telling me that they were diagnosed as pre-diabetic or diabetic, I really want to know what their A1C levels are. Okay.
Okay.
Okay. So this is stuff that's going to be, as I keep mentioning, during my lectures, you need to know this stuff now on a basic level. But if you end up working with a population, especially, I would say middle age and older, you may want to start to, learn a little bit more about, diabetes, because it's certainly an issue that I've seen in my career. I would say men over 50, tend to be diagnosed more than women with pre-diabetic issues, where the A1C levels are, at risk for diabetes. Okay, but I would definitely make yourself, educate yourself on that if you start working with that population. All right, 57. What is the primary muscle used to perform back extension?
B.
Right, rectus spinae. Okay, so where's the rectus abdominis?
In the front, abs.
Abs.
Right, and what about the internal, external obliques?
Sides of abs.
Yeah, right.
Exercise, yeah.
Right through the center, and then you got the internal, external obliques on each side of the rectus abdominis. Okay, so the only one out of these four that makes sense are the erectus spinae. Okay, which are muscles that run up and down the spine.
Hey, Lori, sorry, just have a quick side note question. We just have some trouble with the 3-minute step test. When we do the 1-minute rest, is it immediate after they sit down from recovering?
Yeah, you want to make sure that you instruct the person before they start performing the test what the guidelines are. So they're going to perform a 3-minute step test. At the conclusion of the 3 minutes, remember you're going to count them down, right?
Yeah.
And once you get to that 10, once you give them the 10-second warning and then stop, you immediately have, so you need to let them know about this before the test even starts, that they want to sit down, not speak, and then and instruct them that you're going to grab their wrist and you're going to monitor their heart rate.
But there's we were taught there was a 1-minute rest between them sitting down and taking that heart rate. There's no 1-minute rest. We just want to clarify.
All right, so why wouldn't that, I'm going to throw that back at you. Why wouldn't that make sense if we're trying to determine how fast somebody recovers?
We were
But I
told
thought we
that
did.
Go ahead. I'm sorry.
Sorry, I thought we did it like right after, and then you wait a minute, and then you do it again.
You have the person sit down immediately following the 3 minutes under the assumption that they're able to complete the 3-minute step test. Okay, and I say that. What happens if they don't complete the 3 minutes?
Your test wouldn't be accurate, one.
Well, no, you're not going. Now the goal would be to, at 12 weeks from now, after you train them, assuming that there wasn't any issues that require medical clearance, because of the test, something else was going on. But if it's just because of their fitness level that they weren't able to complete it, then the goal would be 12 weeks from now is to retest and have them complete the test. Immediately following the 3 minutes, they're going to sit down on the step, and you're going to grab their wrist and take their heart rate for 1 minute to see how fast they recover after that bout of 3 minutes.
Okay, that's not what we were being taught, but okay, thank you so much for clarifying.
Please follow the lab, guys. Please follow. Then correct your instructor. Okay, she's indicated that this is her first time. She should have the notes, okay, because I prepared instructor notes and student notes for the lab. She should have the instructor notes. And if she doesn't, show her your student notes. That's what holds. Okay, she will not be testing you, by the way. I don't know if you know that, but it's a conflict of interest if the person who's been training you is now going to be the examiner because of bias. Okay, so she's not the one that's testing you. But if you find fault with what is in the notes and what she's telling you, you need to default to the notes.
Okay, because we've been having a few discrepancies on some stuff.
Okay,
so I just want to make sure we're just 100% ready.
If Jay were here, he'd say the same thing. The book is what holds. Okay.
All right, well, that makes it easier then if we don't have to do any math.
No, I mean, and I'm not saying that you won't, because I can't be an examiner because I'm, usually teaching the course. So I don't believe that, but I don't know. Don't hold me to that because I'm not sure. All right, but have you looked at the practical? Because that was another thing that there's a practical, retired practical exam that he sent all of you. Have you looked at that?
Yeah, those were the videos I was referring to.
Okay, but there was a document in there that kind of.
Okay. It just says like proper assessment if 0 failed this entire section and sent a rating system 0 to 5. 2 is explanation of the assessment. 3 is demonstrated properly. 4 is cued client properly. And then explanation of results, and then goals for client.
Okay, all right, so, take a look at that retired practical exam, but everything that's in the lab book is what's gonna stand for the lab practical. Okay,
All right.
and now that I understand some of the confusion, I will definitely convey your concerns, okay? In terms of what's been taught in the practical, okay? But just know that it's what's in the book, okay? Are you guys done with the labs? You're no longer meeting with the instructor?
Yeah, but the problem is tomorrow is like a lot of our practical exams, so we just want to make sure we're ready.
Okay, all right, I understand the anxiety, I understand 100%. Follow what's in the lab book, and that's the best advice I can give you,
Okay.
all right? If you know what's in that lab book inside and out, you will do fine.
Okay.
Okay?
Mhm.
Okay, what are we up to? We're up to 58. So a 50-year-old client with low back pain has been advised by a doctor that exercise might help alleviate symptoms. Okay, so I think, we mentioned this when we did the review back on the 5th, right? So we just have a little case study here, all right? So that's what the first part is. Here comes the question. Which series of tests should a personal trainer use to safely evaluate the client's current abilities?
I would say A.
So A is a push-up test, 12-minute walk test, chair, stand.
Yes.
Okay, so the actual answer, this is 58, right, is D. Okay, 5-minute walk test, a Thomas test, and a sit and reach test. All right, so let's go back and look at it. A 50-year-old client with low back pain has been advised by a doctor that exercise might help alleviate the symptoms. Which series of tests? All right, so this 50-year-old person is presenting with low back pain. The doctor is saying exercise might help, so clearly there's nothing on a serious level that the doctor's saying we need to send you for further tests, right? He's automatically sending them back to a personal trainer, to the gym, whatever, to do exercise. So what could we assume? What's causing his low back pain? Probably.
Overweight.
Possible tightness in the hamstrings or.
So, winner, chicken dinner. There you go, right? So, Thomas test, right? Doesn't that test hip flexor and also sit and reach test for the hamstrings? Correct. The push-up test won't. The 12-minute walk is going to, talk about cardiovascular. Chair, stand test. I mean, we're going to be talking about leg strength, but we really want to hone in on where the hamstring muscles are, where the hip flexor muscles are, all of the things that might be acting on the pelvis that is causing this person to have low back pain. Does that make sense?
Yeah, that makes more sense.
Okay, great. All right, on C we have Thomas test, but then we have one RM bench press and arm curl test. So that's related to the upper body. We're not saying that those muscles may not be weak. All right, but what's the best choice for this individual in terms of, and maybe by doing the 5-minute walk test, right? It's nothing unusual, nothing grueling, I should say. But we may identify some things when if we observe the person walking, their gait. The step test at this point might be a little too aggressive. The 12-minute walk / run test might be a little too aggressive. So the best choice here is to, go with D, because we really want to see what's going on at the pelvis area with relation to the back. And then a 5-minute walk test is definitely doable, because we could also make the assumption here that maybe this person really hasn't been engaging in, very much exercise at this point. Okay.
So yeah, since due to their inactivity, you want to kind of like stretch them out, right? That's the reason.
Yeah, so the 5-minute walk test will allow them to warm up, get ready for the Thomas test, get ready for the sit and reach test. Yeah, definitely. It's not overtaxing. We're just asking the person to walk for 5 minutes.
Okay.
Okay.
All right, so 59, which of the following is true about stability?
I put all of it.
Yeah, same.
Yeah, I
Yep.
put D.
Yep. Yes, that's correct. All of the above. So, about stability, it is increased when the base of support is widened. We learned about that. What was that? Lecture 1, 2. It's directly proportional to body weight? Absolutely, right? Because, you know, even if you just think about pregnancy, how that changes, you know, a person's center of mass, that's also going to have, you know, have an effect if somebody carries their weight in their gut. And then C, it is inversely proportional to the height of the center of gravity above the base of support. So yes, absolutely the best choice here would be D. So one note of caution, guys, do not change your answer. Okay, the answer you usually choose first is often the correct. There's a lot of research on this. But before you do change your answer, before you do decide on an answer, just look at the question, you know, go back and reread it, and then, you know, determine what's the best answer and look back on the others and see why they could be a possible distraction. Okay. All right, 60. A client is diabetic and morbidly obese. The client has been training on a treadmill for 4 weeks. All right, so we just have a case study here. Now the question, what is a potential benefit to the client in this situation?
Put D.
Yeah, correct.
I put C.
Okay, all right, so let's just look at what is the potential benefit to the client in this situation? Elevating resting heart rate, elevated, so we don't write that. Why doesn't that make sense? A, elevated resting heart rate. What are we hoping that is going to happen as a result of a cardiorespiratory training to the resting heart rate?
Bring it
Come down.
It's going to decrease, right? So that right there, we eliminate A. Increased diastolic blood pressure. Okay. Yes, during the test, which one is the diastolic? Or let's say again.
The lower number.
The low one. So it may increase slightly, it may not increase at all. But what, you know, so that's not, you know, hopefully again, we're like the resting, we're hoping that if this person, you know, is showing signs of hypertension, that cardiorespiratory training is going to decrease the blood pressure, right, overall. Decrease insulin sensitivity. What do we want to have happen with exercise?
increase stroke volume.
We want it to
Right?
increase.
This is the issue with diabetes, right? There is a decrease in, so if this person takes sugar and there's a decrease in insulin sensitivity, it's not going to be able to uptake the sugar that might, that you know, to balance out and create homeostasis again, right? So the only one that actually makes sense, what is increased stroke volume? What does that mean?
The amount of blood.
Right, right? So we want the amount of blood, we want to be able to make that heart work less, but at every beat, throw out as much blood as possible.
Mhm.
Does that make sense?
Yes.
Yeah.
Right? So we want to just get as much blood out of the heart as we possibly can, but within you know, a lower amount of beats, and that's what, so the heart's not working as hard, and that's what cardiorespiratory training is all about. Okay, 61. When interpreting body mass index, that's BMI, results, which factor must the personal trainer consider?
B.
B. C.
All right, what do we think? B or C?
I put C.
Okay, so the actual correct answer is C. Excuse me, is C. Yep, body composition. When interpreting BMI results, which factor must the personal trainer consider? Health status, gender, body composition, and blood pressure. So why do we use BMI?
Body mass index.
Right, the body mass index, but for what reason? What category did that fall into when we talked about in lecture, and then you also talked about it in lab?
Fat? No.
It's percentage of body fat or body composition, right? Falls in the same category with calipers and DEXA and hydrostatic weighing, right? So when you're assessing somebody's BMI, you're trying to determine the person's body composition or percent body fat. Okay, but what do we say? What do we say about BMI?
It doesn't differentiate between fat mass and fat-free mass.
Correct, all right? So that aside, right, that's not what the question's asking, what's the gold standard? That's, and we talked about that, I think, in one of the first 53 questions. That's not what the question's asking. But what exactly is BMI? Where does that fall in terms of these 4 choices? And it assesses body composition. All right, 62. While a personal trainer is having a conversation with someone else, the trainer's client is lifting weights and gets injured. How should this injury be categorized?
Negligence, C.
Okay,
C?
why do you say that? Why do you,
Negligence, yeah.
yep, negligence, why do you say that?
Why did I say C?
Yep, why is C correct?
Because he didn't pay attention to his client. He's supposed to keep his eye on his client at all times.
It's that easy, it's that simple, okay? Did I share with you guys this story where, stop me if I did, but I always have to share this when I I get a recall because of a question like this. So years ago, it's kind of, the story is pretty interesting. I was asked by a person that was a member of this country club that I was training if I would be interested in being the female trainer at this club, okay, country club. There was already a male trainer, and they had a female trainer, but she was no longer employed. And I'm guessing this was an accident, but all the years that I've been training, this has never happened to me. She accidentally dropped a 10-pound weight on a member's head. So she was gone.
Oh.
Exactly. So
God.
now, yeah, sure, why not? Then, I'm not going to turn away work. So one day I was training a client there, a female client, and the male trainer was there as well. Not just training men. I guess I've had the ability to train men if I want. My understanding initially was I was a female trainer, so I guess what they wanted to have was a male and a female, so the members had choices. I still, to this day, cannot believe what I saw, and this is years and years ago. It was just around lunchtime. His client continued to train and get her own weights while he proceeded to eat a sandwich at the entrance to the weight room. And he had enough sense to know that they can't have food in the weight room, but he was in the middle of training a client and he was literally eating a sandwich as the woman was proceeding with her workout.
And he got away with it?
I don't know what happened to him down the road. I eventually just kind of got phased out of there, I guess, because I couldn't put up with the nonsense. But yeah, I guess. I don't know, but it was, yeah, I still remember it. And it still to this day blows me away. But you'll see things like that. Okay, 63. Which of the following is considered a micronutrient?
D.
Yeah, D, all the way.
Correct,
D.
right? Because carbs. So what is carbs, proteins, and fats considered?
That's macronutrients.
Correct. Okay, that's simple. Okay. All right, 64. Motion in the transverse plane occurs around which axis? First of all, let's talk about where the how does that cut the body?
Is that like by the hips?
Yeah, right. So I used the example in our lecture where it's like the person in the box during a magic trick where they have them lay in the box and then they,
Yeah.
they divide the person. So it divides the body into an upper and a lower half. So with that said, what's the correct answer here?
Longitudinal?
Yeah.
The hard thing about this, guys, and I think I might have mentioned this. Have I used this in my, field of practice? Probably not. A lot of this is just going to be straight memorization, or at least, go back to your textbook and, look at that image of the, you guys remember that, right? Where there was a person and they showed the frontal plane, sagittal, transverse, and then they gave the axes. And just kind of like, take that image and then think about, what movements occur in those planes. Okay, that's probably the best way to understand it. Like I said, going forward, I struggle with this still because I'm not using it, in my field of practice on a regular basis. Okay, I use it mostly when I'm lecturing.
Why do they teach us this if it's usually not used during practice?
You may find in your practice you will use it. I'm just, saying in my field of practice, I really have found it important to understand, frontal, sagittal, and transverse. When you get to the point of axes, it's something that just to be quite honest, I don't, I may not use, but maybe you will, okay? And clearly, it's something that it's in every certification. So there is an importance, on some level, at least to have a general understanding of it.
I apologize. Could you repeat the answer to 64?
So somebody want to give the answer again?
Longitudinal, D.
It was D, longitudinal, correct.
Okay, thank you.
You're welcome. Okay, 65. A client has trouble reaching a target heart rate. All right, again, we have a little case study there. So the question is, which step should the personal trainer take?
D?
I would say D.
D.
Reassess.
Let's look at these answers. So 65, you guys are saying D, reassess the target heart rate. Okay, so A is increase activity duration, B, increase activity frequency, C, increase activity intensity, and then D, reassess the target heart rate. So let me ask you, why are you guys saying D as opposed to any of the other three?
What if they're on beta blockers?
Okay, well, we don't have that information, so we're making an assumption here that this person is apparently healthy, if they wanted us to know about that. So let's make an assumption that they're not on any medication. So what drives a person at a duration, frequency, intensity? What drives the ability to increase heart rate?
Intensity.
Yeah, so it'd be C, increase activity intensity.
Exactly. Because right away, I think everybody went to D thinking something must be wrong in our calculation, but they're not giving us enough information here to make that assumption. So this is why we're gonna, go with the fact that if they're not reaching their target heart rate, then it's all about intensity. Okay, not about endurance. Not about the duration, how much time they've been working out. It's not about how often they're working out. It's about that session and the intensity level of that session at that point. Okay.
So the answer is C?
So the answer is C, correct.
Okay.
All right, but does that make sense why I mentioned that it's C?
Yeah, it makes sense because if you take away all the problems that could happen.
Correct, yes. So don't think too much about that stuff, because if they wanted you to assume that, it would be part of the case study. Okay, all we knew in this point was a client has trouble reaching a target heart rate. That's all we know. So you can't assume anything else. All right, and then the only answer that makes sense, if you think about it, is that the intensity isn't challenging enough to get to their target heart rate. Okay. All right, 66. A healthy client engages in steady state aerobic exercise. Let's stop right there. What is steady state aerobic exercise?
When they're past the oxygen deficit.
Yeah.
Wait, say that again?
When they're past the oxygen deficit and they're at.
Okay, I'll agree with that. But tell me what steady state is.
You're holding your heart rate around the same area.
Correct, right? The person's in a state of steadiness, which means that they're probably in their target heart rate zone, right? Whatever that is, 60 to 80% or whatever percentage that you figured out for them, okay? So we know that a healthy client engages in steady state aerobic exercise. The question, what is a typical effect on the client's blood pressure during the exercise?
D.
C.
C?
Okay. So let's go with it. So systolic, what's the systolic number?
It's the top number.
Okay. So does the systolic number decrease during exercise?
No.
It didn't. Okay. While the diastolic remains the same. It more or less does, okay? So B, systolic and diastolic increase. Is that a true statement?
No.
No, the systolic increase, the diastolic does not increase that much, okay? C, systolic increases while the diastolic remains the same. What do you think about that one?
That's the one I picked.
Okay, that's
I think that's the right one.
Correct, because if we go with D, systolic and diastolic decreases. But we know
Yeah.
that's true, right?
That's not that.
So, right. So the only answer that seems to fit is C. Okay. The one thing that I'm sensing is that you guys are going to do fine if you really not only read the question, but also consider each of the answers in terms of which are the true distractors. I think that if you can eliminate, you will see with, like, you know, bright shiny lights what answer actually makes sense to be correct. All right. I mean, that's what I'm seeing tonight in any event. I think that I think you guys are nervous, so rightfully so. I'd be too. You know, I think that if you really take time to read through the question, don't get thrown by the case study, but read that, but then really identify what they're asking, what are they looking for in the question, and then consider each of the choices, but more as distractors that will allow the actual correct answer to reveal itself. Okay? All right. I know it's stressful, guys. I totally get it. But I think that's what I'm picking up tonight in any event. But I think a lot of it has to do with nerves. Okay, let's go to 67. When a muscle starts to contract, which mineral is released in the sarcoplasm to bind with troponin?
Calcium.
Correct. Calcium. Okay?
Hey, sorry, was 66C, systolic increase while diastolic remains the same?
Correct.
Thank you.
Okay, and now 67 is calcium.
Yes.
Okay, I definitely go back to the lecture on when did we do muscle contraction? Was that 3? And just look back in the book. There's really great images on you know, the sarcoplasmic reticulum and that whole process. Okay.
Mhm.
Okay. What is 68 we're up to? What is a strategy used to identify high-risk situations such as smoking or overeating?
B. Relapse.
Right, relapse prevention. So goal setting, right? It wouldn't be goal setting, correct? I mean, it could be a goal that they want to stop smoking and stop you know, eat better. But what we're really looking for is relapse prevention, because we know that you know, people do have that when, you know, they're trying to give up smoking or overeating. Okay. Okay, 69. What should be the first step in pre-activity screening?
A.
Anybody else want to guess?
D.
I would say D.
Okay, so the answer happens to be D, but let's look at this. So risk factor assessment, we first have to know their risk factors, correct? And we're going to get that through the data we're going to collect from the forms, the PARQ, you know, the med history. We don't know if we need to send them for physician's consent, or, you know, let them go to the doctor for the doctor to sign the physician's consent, because we have to go through all of the pre-screening first, right? And then we certainly don't want to set up an exercise program till we go through the pre-screening. So the one that makes sense here would be first, let's get the medical history review, because that's going to give us all that information that will allow us to deal with A through C. Okay, does that make sense?
Yes,
Yeah.
we actually do the order that it should go.
Yeah, I would definitely follow the order. You know, but you know, it also is going to depend on where you end up working. You know, are they going to start with a PARQ and then move? What I do myself is I don't use a PARQ, I use med history. Okay, because
Okay, so there's not like one actual way of what goes in order. So it's just, we just try to start out with the medical history.
So again, it's just a bit, follow the lab for the test. You know, I think the order for the, in the book, it says PARQ first, I believe, and then to med history. But so follow what it is in the book for the practical, But what I'm stating here is that in my practice, I get the most amount of information out of the med history form, so that's what I use. And then from there, based on how that form is filled out, that's when I make my move in terms of where I'm going to go. Do they need a physician's clearance form? Have them sign the informed consent, and then make choices based on either, you know, what was provided to me and what the doctor's stating if a physician's consent is necessary.
Got it.
Okay.
Now for a practical, do we need to know, like, are they going to ask any of these questions about forms or no?
I know that's, you know, heavily weighted in your, I think it's the first lab, I think, right? So.
Yeah, I just want to make sure it's not on the test because we were told that was not going to be on the test. Like for
Okay.
the practical?
Yeah, look at that practical, you know, the example, that retired practical exam. If there are any questions on that, then it won't be on there.
Oh, sounds good.
Okay, we are up to 70. Okay, a personal trainer designs a weight training program that uses high resistance with low repetitions. So there's the case study. The question, what should be the rest period between sets?
B?
Put
Okay.
C.
So
Let's
this
see.
is what A
C.
is less than 30 seconds, B 45 to 1 minute, C is 2 to 3 minutes, and then D is greater than 5 minutes. So what did you guys suggest?
B?
So it's not that your answer is incorrect, because to me it's more of an independent thing, but for this test, the correct answer is actually C, 2 to 3 minutes. Okay, I might have mentioned this in our lecture. True sign of, you know, of rest, they could do a tissue biopsy, and it's 8 minutes by the time lactic acid is actually removed 100% from the muscle. But we all know if we're going to wait 8 minutes from it between every set and every exercise, we'd be at the gym for days. So, but the range is 2 to 3 minutes. But, you know, again, some people, I mean, call out, what's your rest period? Call out your rest periods for. Oh, and then here's the thing I want you to note here, though, okay? Because as I'm saying this, note that it's saying high resistance, low repetitions.
Mm-hmm.
So this is why C would also be a better choice. Okay?
Thank you.
If it were the other way around, low resistance, high reps, maybe B would be fine. Okay, but we're talking about high resistance, low repetitions, and so the choice is C, 2 to 3 minutes. Okay. All right, 71. Which fiber type contracts slowly, produces low force and resistance to fatigue?
Type 1.
Correct. Type 1. Okay, it's the first one that's recruited, and that's the one we use, you know, for aerobic activity for the most part. All right, 72. Which of the following is a multi-joint exercise that works the pectoralis major?
D, bench press.
Right, so where are the pecs?
Your
Chest.
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 Right, so which of the following is a multi-joint exercise that works the pectoralis major? And we understand multi-joint, right? So if we're using the bench, so the answer was D, right? So what's the joints that are moving during that exercise, bench press?
Shoulders, elbows, wrist.
Yeah, okay. Not so much the wrist, because the wrist is neutral, but the elbow and the shoulder, correct? So that's why if we're doing a dumbbell fly, you know, remember it's this here, right? So what's the joint that's moving during a dumbbell fly?
It's the shoulder.
Okay. Lateral raise actually doesn't even make sense, because what exercise are we using there? What muscle group are we using there?
Shoulders. Delts.
Right? And then seated row, what exercise, what muscle?
Lats.
Say again?
Lats. Latissimus dorsi.
So we're doing a seated row. Okay, yep. Lats, right. Yes, there's a bunch of, I didn't hear, I thought you said deltoids, but yes, you're correct, right? So right away we can eliminate. If we just look at, we know seated row works the back. Lateral raise works the shoulder. We're talking about the pectoralis major. So the only two that were possible was dumbbell fly and bench press. And if we analyze the dumbbell fly, we're not moving any other joint except for the shoulder. They mentioned multi-joint exercise. Okay. Is that starting to, is things starting to click here with in terms of how to choose the correct answer?
Yeah.
Okay, good. Okay, 73. Which exercise prescription is most appropriate for a client who wants to achieve cardiovascular fitness?
C.
C.
Yep, you got it. So 60 to 80% of heart rate reserve, 3 to 5 days per week, 20 to 60 minutes per session. Okay, it's right out of ACSM guidelines, basically. Okay. All right, 74. Which term should be used to describe how quickly a food elevates blood glucose levels after ingestion?
C.
Glycemic index.
Correct. Okay. And this is a thing now, you can find it on a lot of foods, you know, what the glycemic index is, you know, especially for people that have to worry about that. Okay. Whether it's hypoglycemia, diabetes, that kind of stuff. Okay. But yes, glycemic index. Okay, 75. A client reports low back pain. Client sits at a desk 7 hours a day for 5 days a week. All right, so we're really getting a good picture of this person. So they're telling you they have low back pain. They basically sit 7 hours a day, 5 days a week. The client's anterior pelvic tilt is causing increased lumbar lordosis, right? So when we're talking about anterior pelvic tilt, the top of the pelvis, let me get my pelvis here. Okay, this is what you guys can see this, right?
Yes.
Okay.
Yeah.
So this is what we're talking about. Which way is it pointing when we say anterior? This way or that way?
That way.
Outer.
So that
Yeah.
way.
Outer.
So where is the lorthotic curve?
Lower back,
Yeah,
above
lumbar,
the,
right? The
Yeah.
lumbar curve right here, right? So if the pelvis is tilting that way, would we expect the lordotic curve to go this way or greater than what it might normally be?
Other way.
So think about it. So here, so I know it's a bad example, but I'm going to just use my hand. So let's say this is the lordotic curve. My pelvis is tilting anterior. What's going to happen to the lordotic curve?
It's going the opposite way.
So it's
Yeah.
actually going to increase the curve.
Oh, the curve.
Or try to, right? Because it's tilting. So if this is the lumbar here, the further my pelvis tilts forward, the more the back is going to be, trying to stop it from doing that. So the curve is going to be a little bit more exaggerated.
Because it's kind of pulling the bottom of your, if we're looking at your hand, it's pulling the bottom of your hand in the direction that it's going.
Correct, right?
That's
It's
the
going
increase
this
the curve.
way. Okay,
Right.
I know it's hard to understand that, but if you're pulling this way, then more of that's going to happen. If I go the other way, it's more of that.
Okay.
Yes?
Yeah.
Okay. So, all right. So, so we know the person sits most of the time, causing an increase in lumbar lordosis. Okay. When we use the word lordosis, okay, we refer to the curve as lordotic curve, but anytime we add the OSIS, what is that telling us right there?
It's some type of condition.
It's an inflammation of, anytime osis, it's an inflammation of, okay? All right, so now here's the question. Which of the following muscles most likely need to be stretched as a result of the client's daily postural habits?
E,
Hamstrings.
75.
but hip flexors.
Okay, yeah, exactly. It's
Yeah,
D,
D.
hip flexors.
D?
Okay, listen, there's probably a lot of things going on. It's not just one, but the best answer for this question would be to stretch the hip flexors. Okay, which test is going to tell us about them?
Thomas?
Correct.
The Thomas test.
Okay, so that might be something that you want to consider, assuming that everything's a go with the assessment. Right away, based on what they're telling you, perform the Thomas test and see what's going on with the hip flexors. Okay. All right, let's do a couple more and then we'll take a break, all right? So we're at 76. At a respiratory exchange ratio, so that's R, value of 0.7, which primary fuel is being used for energy?
Fat.
So yeah, it's fat, C. So, this is kind of a hard, they actually do this with, when they're testing on a treadmill or a bike where they'll measure people's gases. And so that's how they're able to determine the respiratory exchange rate. But you can actually see this on the computer, how a person starts off and where their fuel switches depending on their intensity, okay? But for this question 76, the correct answer is C, fat, if it's at a 0.7. I'm sure your textbooks, I'm pretty sure I probably showed you this on, yeah, I know we did in one of the lectures. I can't remember now which chapter or which lecture, but.
Page 91.
Okay, great. So 91 has, what is there, a table or, some sort of grid that shows you that, correct?
Yes.
Okay,
There's
great.
a chart.
Okay, yeah, actually, I can probably pull this up here. Let's take a look at that. Thank you
It's
very
a
much.
respiratory exchange ratio and exercise time.
Okay,
Figure
right.
4.2.
Yeah, so right here. Okay, so I know it's not a little hard to see probably from your end in terms of, let me see if I could blow this up. There's no scale there. I'm just gonna look and see if I can get you a zoom. Actually, zoom to, I'm not sure if it's gonna let me. Oh, no, it's okay. All right, yeah, I don't want to start messing with the.
If you go in the bottom corner, it looks like there's a magnifying glass.
Oh, yeah, there we go. All right, thank you so much. That's what I was looking for. Thank you. All right. Okay, so this is what we have on the left side. It's the R, ratio exchange, and then we have the exercise time, and we see how that changes. So initially we start off with 67% from fat, 33 from carbs, and then you can see over 90 minutes how we're depleting our carb stores, right, which is what we would expect, and now we're drawing, from fat to break down for the purpose of energy to continue the activity. Okay, so yes, thank you for pointing that out.
Mhm.
Okay. All right, where are we? Okay, 77. What reflects the characteristics of trustworthiness regarding the ethical standards of a personal trainer?
Confidentiality.
Correct, right? So ethical standards, absolutely. I mean, we want to have empathy and sympathy and communicate, but the bottom line is, HIPAA, you have to make sure that, that anything that is, collected data-wise from any of the forms, anything that is spoken to you, you don't tell tales. I always tell people it's not my story to tell, right? So you definitely want to make sure, especially if you're working in certain communities, going to people's homes and so on, and you happen to train friends of friends of friends of friends, the last thing you want to do, you will not last long in this industry if you go to someone's home and then go to somebody else's home and tell them things that was shared by that client or things you saw in the house. Never a good thing to do. I actually known trainers that have, lost their jobs because of that. All right, 78. A personal trainer has been working with a novice client for 2 months. All right, so there's the case study. Question: what should the trainer be most concerned about?
C, relapsing.
Correct. Okay. Not that we shouldn't be concerned about overtraining, overreaching, plateauing, or any of those, but it's still, they're novice. They've only been with you for 2 months, or exercising for 2 months. So there's always that, that concern that they may relapse and stop coming. Okay. So absolutely. All right, let's go. We'll take a break after this, and then we'll come back. We have 30 questions to do it. What did we just do? Almost 50. We did 54 to 79. So yeah, we should be fine for the rest of the time to get through everything. Okay, 79. A client becomes breathlessness and is unable to complete a 3-minute step test. The only risk factor that the client has a family history of cardiovascular disease. All right, so there's our case study question. What should the personal trainer do in this situation?
A, refer the client to a physician.
Yeah, A.
A.
So, all right, so, yeah, again, they're not giving us a hell of a lot of information, but the assumption here could be that they're not able to complete the 3-minute step test because they're breathless, but why could that be? And so clearly, an assessment, pre-screening was done, right? Pre-activity screening was done because we know that the only risk factor that this person has is family history. We've ruled out everything else, okay? So even though we don't have a ton of information, we can assume here, because they're saying the only risk factor that this client has is family history cardiovascular disease. So we can make an assumption here. This person went through the pre-screening process. There was no need for physician's clearance. They can't complete the 3-minute step test because they're breathless. So what assumption can we make here?
They're out of shape.
Yeah, exactly, right? So what should the personal trainer do in this situation?
B.
I'm thinking C now. C.
Correct.
Yes.
Correct. We can prescribe moderate intensity aerobic activity. We won't want to do vigorous because already the step test was too vigorous. Okay, so that's off the table. We don't want to prohibit aerobic activity because that's the very thing they need to be able to, improve to complete the 3-minute step test. We don't need to refer them to a physician's because we've already done the pre-screening and that wasn't, we can assume here that wasn't part of, there wasn't a need for that. So the only thing that we can assume here is that we should prescribe moderate intensity aerobic activity, hoping that we can get them to a certain level of fitness so that 12 weeks from now when we retest, they will be able to complete the 3-minute step test. We talked about this early on, right? So this is just a full circle moment. So, based on the information given, the thing that we want to do is improve their cardiorespiratory fitness levels so that 3 months from now, they will be able to complete that test. Okay? All right. It's 7:32. All right. I want to get through the rest. We're on till 8:30 together. So is a 5-minute break okay for you guys?
Yeah.
Yeah.
Fine.
Okay, great. All right, come back at let's say 7:33 now. So or it's 6:33 by you guys. So let's go to 7:38 and then we'll finish up the questions.
Okay.
All right, enjoy.
But you want to go out? Not really discussing.
All right, guys, back with me?
I'm back.
Okay, great. Okay, so we're up to 80, right? Okay, so a client shares the experience of being inactive and overweight with a personal trainer. Client shares the experiences of being inactive and overweight with a personal trainer. The personal trainer understands the client's situation from past experience. So the question, what does this describe?
B.
Empathy.
80, did we say B or D?
B.
Empathy. Empathy.
Empathy.
Right. D is the correct answer. Okay, empathy.
Oh.
And that was, I think, from lecture 5, right? Okay, 81, what occurs during the eccentric phase?
C.
First of all, when's the eccentric phase? When is that? When does that occur? In a bicep curl, let's go with the bicep curl. When does that occur?
On
Lengthening of your arm.
Say that again?
Like
What?
that.
The lengthening of your arm.
Okay, so when you're lowering the weight, correct? Okay, so so what answer makes sense?
C.
C.
D.
I'm saying D or C?
D.
D.
D as in cat?
Yes.
Yeah.
Yeah.
Okay, muscle lengthens in the direction of gravity, right? Gravity comes down. So yes, that's correct.
Okay.
Okay,
E as in cat.
it's C as in cat. Muscle lengthens in the direction of gravity. That's eccentric. Okay. All right, we're up to 82. Which style of resistance training is the safest for new fitness clients to use?
A.
A.
Weight machines, yeah. As opposed to kettlebells, medicine balls, and dumbbells. Probably because the learning curve is probably greater on the other choices. You know, machines still require adjustments, and you know that not all machines are accommodating for everybody. But out of those choices, the learning curve is you know, less with weighted machines than the other 3. Okay, 83. During exercise, what is the primary way heat is transferred away from the body?
A.
evaporation.
Yeah. Yeah, that was our lecture 5. We talked about that, right? Okay, 84. Which of the following free weight exercises works best with the quadricep and the gluteus maximus?
B, barbell squat.
84, right? Just want to make sure I'm giving you, yes, correct. Okay, so does everybody understand why the others would not be correct, right? If you just think about the muscle groups.
Yeah.
Mhm.
Okay. Good. All right, 85. Which skeletal muscle fiber type is fast contracting? We actually already did this one, didn't we? Okay. What was the answer on this one? This is a repeat.
It's worded a little bit differently, but I put B as in boy.
Yeah. Same.
So, oh, actually, yeah, generates high force. And let's see, which skeletal muscle fiber type is fast contracting, generates high force, and resists fatigue? So wait, that's let me just make sure. 85. So what did you guys choose?
B.
A,
Yeah,
2A.
okay, yes. Okay.
What did you say?
So the answer is type 2A as opposed to type 2X, which is what the first question had asked us before.
Thank you.
Okay. Okay, 86. Which of the following describes movement that occurs in the sagittal plane around a medial-lateral axis?
Flexion and extension.
A.
Correct. A. Okay. Right, because the sagittal plane cuts what?
right and left.
Right. Okay. Good job.
What is a medial lateral axis? Is it kind of like a transverse plane?
No, so that's the difference. That there's planes and there's axes. So better off that you go back to the textbook and there's that image.
I know I looked at it and I was trying to figure it
Yeah,
out.
so it should show in the image the difference between what a plane is and what an axis is. Okay, an axis is, you know, that something moves about. as opposed to the plane that cuts the body, you know, upper and lower, right to left, front to back.
Okay.
Okay. Okay. 87. All right, we're up to, yes. Which of the following environmental conditions could be dangerous to exercisers?
D.
D.
So yeah, all of the above for sure. Air pollution, hot. Have you guys been getting that in? I know every day here they do the air quality alert. You guys had that in Chicago?
Yes.
Yeah.
Get notified? Okay, yeah. So yeah, so all of these things will definitely be dangerous to people. I mean, they're even saying that on the news. You know, if you have to go out and exercise, do it early, and so on and so forth. Okay, 88. Which muscles are located on the anterior portion of the upper leg?
B.
Quadriceps.
Okay, yeah, so what's the anterior?
Front.
Right, the front. So and then the upper leg, right? So the only muscle here that makes sense is where's the hamstring?
In the
In the
back.
back of the leg.
Posterior portion of the upper leg. Then we have the gastrocnemius, which is where?
Behind.
Behind.
The anatomically correct. Where's the gastroc?
The calf
That's a
complex.
calf complex.
Calf. Like the front of the calf.
Posterior portion of the lower leg.
The lower leg, right? And then what about the
Yeah.
tibialis anterior?
Anterior portion of the lower leg.
Correct. That's exactly right. Okay, for what should rice be recommended as an initial treatment? First of all, what's rice?
Rest,
Rest,
ice,
ice.
compression, and elevation.
Depression.
Okay, so what's the correct answer on this?
A.
A.
Soft tissue injury, for sure.
What does RICE stand for again?
Yeah.
Rest, ice, compression, and elevation.
Okay.
Okay,
Thanks.
you're welcome. All right, now a client sprains an ankle. What type of body part is injured?
Ligament.
Soft tissue injury.
Wait, you
Yeah,
said-
ligament. That's what
It's
it
a
says.
ligament.
Yeah.
Yeah, so, and typically that's what gets injured when somebody sprains an ankle. Because you can remember the key word, it's saying sprained. Okay, so typically it's a ligament in the ankle. I mean, they're not telling you which direction. Usually, you know, it's the outside ligaments, but yeah, typically it's ligaments.
And then strain is just like little like fractures in the bone, right?
Is that what it says in your, when you strain something, strain?
Yeah, because I took like, I think it's in our Quizlet, so I was just making
Okay.
sure.
What is it? Let's just look that up.
Not a strain was when you pulled a muscle.
Yeah, what,
I think it's muscle because sprain is for bone.
yeah, what is a strain
Right.
muscle? Yeah, so straining,
Sprain is
a muscle, well, it's muscle strain. A strain is an injury to a muscle, particularly connecting muscle to bone. Okay, so here's strain. A sprain is an injury to the ligaments and the capsule of a joint in the body. A strain is an injury to a muscle or a tendon. All right, so it has to do with the word strain or sprain.
Thanks.
Okay. Okay. Okay, 91. Which energy system is primarily utilized during long duration, low intensity exercise?
That'd be aerobic metabolism.
Right, for sure, right? Because already we know it says long duration, you know, and if we're gonna go long duration, it has to be lower intensity, right? So we're in the aerobic system, and why are we saying aerobic system? What is, you know, a key factor of the aerobic system?
Uses
Uses
oxygen.
oxygen.
Yeah, right. Okay, it produces energy, ATP, in the presence of oxygen, so that allows us to sustain activity for longer durations. Okay. All right, 92. A personal trainer releases information to the client's doctor without the client's approval. Which type of violation has the personal trainer committed? We talked about this.
B. B.
C.
D or C?
C.
B.
Right?
I would say C.
Yeah,
I said
that's
C.
I could see.
Yep, client personal trainer confidentiality, because it's, we talked about this, lecture 5, and you must let your client know that if they provided you with information like on the med history form with regards to their doctor, name, address, whatever, you still need to let them know that they're going to be you're going to be sending, the doctor a physician's clearance, and they need to sign off on that. And if they don't, then you can't send it. But then you also refuse, them being able to join or personal train with you, join the gym or personal train. Okay, 93. What is the primary muscle used to perform the seated cable row exercise?
Latissimus dorsi.
C.
Mhm.
Right, the latissimus dorsi, correct.
Where is
Okay,
that again?
so 93 was C, latissimus dorsi.
That's okay.
So it's, yeah, 'cause it's not going to be the biceps, although the biceps do assist in that. It's not going to be the triceps, right? Because we're not doing extension of the elbow. And then upper traps, typically get worked when we do shoulder shrugs. Okay, so, person shrugs the shoulders while doing the exercise, yes, the upper traps. With the main focus, we want to know what is the main exercise. The key word here is primary. What's the primary muscle used?
Okay.
And the answer is lats. Okay. All right, 94. A client states, I want to get healthier. The personal trainer asks questions and encourages the client to be more specific about goals. The question, what does this process describe?
Concreteness.
Concreteness.
B.
B, yep, concreteness. Nice. Okay. Another thing we talked about last week, right? All right, 95. Which primary muscle is working during a one-arm dumbbell row exercise?
Latissimus dorsi.
I guess I like the lats as an answer. Yes, correct. Right? We all know what a one-arm row is, right? So we're pulling the weight back. So pecs don't make sense. We're not working the rectus. I mean, we might work the rectus abdominis in terms of stability of the spine. The erectus spinae, are also working. But again, the word that we need to focus on is the primary muscle. Okay, so out of these choices, what would be the best one to describe the primary? All right, 96. What is the most accurate method to assess fat-free
What was
mass?
95? I'm sorry.
95 is lats, A.
Thank you.
Okay, what about 96? What's the
I
most
put
accurate?
A for 96.
Did
What is-
A for 96.
Yep, A,
Yep.
hypostatic weighing. Okay, not skin fold, not hip to waist to hip ratio, and not BMI. Okay. The most accurate, the less margin of error in this set of 4 would be hypostatic weighing. All right, 97. When administering the Thomas test, the client's collateral leg moves significantly when the client's knee is drawn to the chest. Which of the client's muscles are tight?
Hip
D.
flexor.
D.
Muscles.
Right. D. It's hip flexors, correct. All right, we talked about this already earlier.
Mhm.
Okay, 98. An individual plans to hire a trainer in the next month. According to the trans theoretical model, at which stage of change is this individual?
B, contemplation.
C, preparation.
Yeah, it's actually C, preparation. The only suggestion I have on that, guys, is just go back and read all 4 of those as it relates to that model. Okay, but it's C, preparation. Because I guess, the thing that you want to get here is an individual plans to hire a trainer in the next month. They're not saying, you know, maybe in the next couple of months. It's very definitive. So that's where we're getting, they're not contemplating anymore. They're pretty much certain that they're gonna do that. So they're preparing for that. Okay, 99, a client has orthopedic problems and needs to lose 30 pounds. The question is, which cardiovascular exercise is most appropriate?
Aquatics.
Yeah, definitely, guys. You know, don't ever not, you know, consider that if you have access to a pool, especially if you work for a facility where they, you have access to pool year-round, indoor pool. The pool is a great medium for a lot of different things. I think I shared the story with the woman I worked with that had MS. We started in the gym and movements were so spastic. I asked her if she'd be interested in doing pool stuff, and it was as if, you know, she didn't have MS. So it's always a great medium. Okay, 100. A personal trainer is applying stretching exercises to a pregnant client. For which reason should the personal trainer use caution?
It can cause excessive, joint laxity.
Exactly, yeah, because of all the hormones in preparation for pregnancy, you know, the joints become very lax, especially around the pelvic area. So you need to be very careful about excessive joint laxity. Stretching is not a goal during pregnancy. Okay, flexibility, I should say. Okay, 101. According to ACSM, American College of Sports Medicine, what does the scope of practice for a personal trainer include?
B.
Recommending appropriate exercise programs.
Correct, right? We can't offer medical advice because we're not doctors. We're not nutritionists, so we can't suggest supplements. And we can't talk about pain management because we're not physical therapists or chiropractors or doctors or anything. So the only one that makes sense here is recommending appropriate exercise programs. All right, 102, unless expressly granted by the client, who should be given access to the client's health information?
Client only.
D.
Yep, D, client only. Not the gym manager, not the staff, gym staff, not the family member. Okay. 103. Elevation and depression are associated with which bones?
Scapula.
Scapula.
Right. Because so basically, when you're shrugging your shoulders, right, that's what you're doing. Elevation, depression. Okay. Okay. 104. What is the bone classification for the vertebrae?
Irregular.
Right, C, irregular. Good job, guys. Okay, 105. What is EPOC?
D.
That is
Right.
D.
Excessive post-exercise oxygen consumption. What does that mean?
Like
That's
when you finish a
that's
workout, you have to
oxygen that you lost in.
We talked about the deficit at the beginning,
the
and
deficit.
now it's paying it back at the end.
Mhm.
Okay.
Mm.
So a lot of the physiological responses, although they're not going to be as high as exercise, you know, heart rate, blood pressure, all of those things, but the body is in a payback mode at that point after the exercise has ended. Okay, 106. Resistance training program has excessive frequency, volume, or intensity with adequate rest and recovery. Which condition can this program lead to?
Overtraining.
Training.
106D, yes, for sure. Okay, and I'm pretty sure I shared the story one of my professors told me about. You may, you know, see this with people, you know, I've always said that there's some level of addiction that has to occur, you know, to people to be committed to exercise, you know, but there is a fine line. There are people that do get obsessed with exercise, and you'll just need to notice that, you know. Okay, 107. Which action occurs when a muscle shortens while producing tension?
Concentric.
So the answer is C, right, concentric. Okay, so the muscle is shortening, so we could go for a bicep curl, right? The up against gravity, shortening, okay, reducing tension to lift the weight. Okay, 108. Internal and external rotation occurs at which joint?
Ankle?
Ankle.
Hip.
Yes, it's the hip. Okay.
Oh, yeah, I was wondering if it was
What's
the.
it called at the ankle?
Okay, so it's C. Okay.
I think that, you know what, I think what confused you there was the I and the E. So what is it called at the ankle?
Inversion and eversion.
Oh,
Correct.
yep. You got me.
Oh,
All right, so inversion, so this is my ankle, inversion, eversion, but when I'm talking about my hip, okay, I'm rotating, okay, the head of the humerus is internally rotating, externally rotating, okay, a little different than the ankle doing, you know, what I would call like a windshield wiper kind of movement, okay, so inversion is when you can see the bottom of your foot, and then eversion is when you can see the side of your foot, but that's different from internally rotating and externally rotating. That happens at ball and socket joints, so you can do this at the shoulder as well, internal and external rotation. Okay, 109. After performing a client's fitness assessment, a personal trainer documents the following results. Okay, so resting blood pressure greater than 140/90, resting heart rate of 75 beats per minute, body fat percent of 18%, 10-minute walk at 3 miles per hour. Which results presents a risk factor for cardiovascular disease out of those?
A.
Yeah, A.
Correct. Okay, 140/90, that's classified as hypertension, stage 3, I think, hypertension. Okay, the last question, a client has diabetes and takes insulin. Which risk should the trainer be aware of in this situation?
Hypoglycemia. A.
Correct, hypoglycemia, okay? You know, because there is a fine line too, you know, with insulin if too much is taken. All right, so yeah, so you know, like I've been telling you guys, if you do want to work with, you know, these are all considered special populations. If you know you do have the desire to work with clients, and to be quite honest, you know, more Americans than not have you know, a lot of these risk factors. So it's probably, you know, one of the things that you might want to consider going forward when you need to take your CECs to maintain your certification after you pass the certification exam, is maybe take a workshop on special populations, so it gives you a better idea of, you know, how to work with these people. So, all right, so overall, how did you guys feel about this? Or how are you feeling about the test after the review?
Nervous about the test.
So you guys,
Unless,
I think I'm
Unless
more
it's-
nervous about the practical because I have to relearn it now.
all right, so
Yeah,
just
the
go back,
practical, I'm gonna.
and look at the lab, go look at that practical review, okay? And, you know, just look at the, take the practical review, the retired practical review, and then go to those sections in the lab book. And again, Jay will always tell you, the books trump anything else. So whatever is in the lab manual, whatever's in your textbook, whatever's in your notes, okay, all of that should match. That's what holds.
okay. Sorry to touch base on this again, but I think some of us still have clarification on the step test, because I'm looking at the 8th edition
All right, let me-
notes for the practical. But it has a section C, recovery versus post-exercise heart rate. And it lists post-exercise heart rate and then recovery heart rate. But just for this practical only, we're probably just looking for the recovery heart rate, right? That's it, just sit for
Yeah,
the minute.
Yeah, I think I know what you're talking about. So yeah, it goes into the difference between recovery. Okay,
Yeah,
yeah, I know
like-
exactly what you're talking about. So yeah, and then it says, yeah, recovery versus post-exercise heart rate, right? So it goes in and explains what those two things are. But what the step test is measuring is how fast somebody recovers. Okay, so that's why you're taking the heart rate for a full minute after the test is complete. Have them sit down, remain quiet, grab their wrist, and take a, because you're testing a recovery, not the post-exercise heart rate.
Well, what are we comparing that to?
Yeah, do we have to remember the chart?
Yeah,
or-
that's I don't,
You're not going to have to remember this chart, but this is the chart. So assuming that you've done everything correctly,
Yeah, then
this
you just
chart
base
is
off the
broken
chart.
up into men and women and age. So based on their recovery, you're going to let them know if they fared excellent, good, average, below average, poor, based on their sex and their age. That's what this chart is about.
Because
Okay.
our instructor, she she didn't know if we needed to know that or not. She's like,
You're
I'm
not-
not sure if they're gonna.
You're not
Okay.
going to have to memorize. No. They
And then
might
this
give, maybe the examiner will give you the chart and say, which category would you put this person in? Okay. Guys,
Hopefully they would
understand
provide
extra
that.
and the practical, they're looking for you to talk. Okay. They want you to, if you should say, okay, based on the outcome of the recovery heart rate, I'm going to compare the number to this individual to the step test norms that are appropriate for their age and their sex.
Okay.
You don't need to remember the numbers, but you certainly should address that because they're looking for that. They're going to stop you when they hear everything they want to hear.
Right.
Okay. So as long as you're not going off on a tangent someplace, but yes, testing recovery heart rate because I want to see how quickly a person recovers from this bout of exercise. Because guys, you got to remember, if somebody walks into a room and the lights go on and they go, surprise, our heart rate and blood pressure shoot up. That's normal physiological response. The problem for an individual that has pre-existing conditions, their heart rate and blood pressure are not coming down so quick. So you can imagine the demand on the heart as a result. Okay, and usually if there is some sort of recourse as a result of that type of event, it's because there was pre-existing conditions, right? But nonetheless, if someone's out of shape, it's still going to take them time to recover, right? So if through the cardiovascular respiratory training, if we can elevate their heart rate and then it recovers quicker than someone else who's not in condition, that's going to be better for that person and their heart. Okay, so that's what we're looking for, is that we stress this person, okay, but how quick after the stressful situation are they going to recover from that bout of exercise? And that's what we're testing in the step test.
Okay, I appreciate that.
All right, but yes, by no means will you need to memorize any normative data, but I would recommend saying, and if they've heard enough, they'll tell you that's okay. I understand where you're going with this, but just say, I'm going to do, they may not even ask you to do a full recovery. I don't know because I'm not the examiner, but you talk it through, okay? I am going to, now, as you're even doing it, all right, so you're going to explain all this stuff ahead of time, but as you're doing it, okay, so now, as I explained, sit down, or 10 seconds left. Okay, we have 10 seconds left in the step test. When I count you down, I want you to immediately sit down and I'm going to grab your wrist just as a reminder and take your heart rate for a full minute. And if you feel that the examiners are still wanting you to do that, then pay attention and take because they may be on the other wrist, waiting to see how accurate you are. And then following that, I would verbally say, so now I'm going to take this number and I'm going to compare it to the normative data based on this person's sex and age.
even if you don't have the information
just
in front of you.
Just say it because they'll stop you if they've heard enough. Okay, because they are looking for stuff. They are looking for you. They want to know you know the protocol. Okay, so better off that rather if they start asking you questions, it's because they haven't gotten what they're looking for.
Mm-hmm.
So know the protocol and just boom, 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 just rattle it off.
Okay.
Okay, you can't go wrong saying much if it fits in within the scope of that, that test.
Would they give us a person who wouldn't be able to finish the test, like completely?
That could be. You may have somebody, because you're definitely going to have somebody that you'll work with. I don't know if it'll be one of the people you've been, studying with, but one of you may serve as a subject, and the trainer, the examiner may give information. May may say to that person, here's what you're going to do during the test, to throw you and see
And
how you respond. The only thing I can
with
say,
that-
watch. Don't get so caught up in your metronome and all that. You gotta look constantly. They're gonna be looking for that. Because to be quite honest, if you're too busy on your devices or whatever you're doing, they may say to the person when you're not looking, whatever, pretend, or now, do it now, whatever they told them at the beginning. And they're gonna see that they're gonna want to see how quickly you notice and how you're gonna respond to that.
Okay, and even if they're not able to finish the test, do you still take their heart rate?
At that point, yes, you can record it if you'd like to, but you can't compare it to any normative data because you didn't finish the test.
Okay, I just want to make that clear.
Right? I mean, you could definitely take the recovery at this point, but then you're going to say, okay, the person was unable to finish the test. So let's say they stopped at 2 minutes and 20 seconds. Okay, I'm recording the time that they stopped. I'm going to take their recovery heart rate now. Can't compare it to the normative data because they didn't complete the test as it's written. But I will note this so that the next time we repeat this test, at least we have a basis for comparison from the first test. So now you could say to your subject, it's 3 months have passed, you did the 3-minute step test, you scored an average for your age, range, and sex compared to what we did 12 weeks ago, which was you had to stop after 2 minutes and 20 minutes, and here was your recovery heart rate.
Okay.
All right, so just talk it all through. Just do, like I said, you can't say too much if it falls within the parameters of the test.
Yeah.
Okay.
Mm-hmm.
Any other questions on that?
For setting up the tests, we get time before the patient comes in or the person comes in? What do they?
I can't answer that 100%. I don't know if, so let's play devil's advocate here. They have the right to ask you to set up the test, but if they have it set up, they may ask you, how far was the tape on, the abdominal curl? And you're going to say?
10 centimeters.
Correct.
Mhm.
Okay, what's the metronome set at when you're doing the step test?
96.
Right. So even though they may already have everything set up, they could ask you questions about, how is this, or maybe they'll throw you and tell you, okay, we're doing the step test. I already set up the metronome set for 60. Okay, again, I'm just throwing scenarios out there, but you'll know better. You'll be able to tell them.
Right. They're gonna ask us, they might ask us to do something that's not correct.
No, what I'm saying is that let's say I'm the examiner and you're getting ready to do the step test, and I'll say to you, you know what, no worries, I already have the metronome set up. I have it set for 60. What are you going to say to me?
You say that's not correct. It's 96.
Correct. That's what I'm saying. Is that they may throw scenarios like that. They may tell you that they may say it's set up, but they want verification, okay? Or they may tell you it's set up and they're giving you wrong information because they're looking for whether or not you know the correct information. Okay, or they may have you set it up. Okay, so you just need to be prepared. Just know the protocol. And then any of those scenarios you will not be thrown by.
Okay.
Let me just turn it away here so you guys can see. Does that help at all?
Helps
Yes.
a lot, yeah.
Okay.
So
Yeah.
much. Awesome review.
I'm telling you, just go through this, especially this was lab 2, right? Go through this, okay? And make sure that you know this stuff backwards and forwards. Like I said, you don't have to memorize the charts, okay? But just know that there are normative data for some of the tests. Not all of them, but some of them you will need to know it, okay? Not know the chart, but know that you need to compare it to the chart.
Okay.
They might turn around and say, let's just go back to the step test again. They may turn around and say, all right, they don't make you go through the whole test with that person, okay? It's supposed to be 3 minutes and what you're going to do following that. But let's say they stop you at 2 minutes, okay? If the tester doesn't say to you, the examiner doesn't say to you, okay, we're going to stop here at 2 minutes. Let's pretend the person completed 3 minutes. do the, what are you going to do from here? And then you'll go ahead and say, okay, well, I'm going to sit the person down now, and I'm going to do a recovery heart rate for 1 minute. But if they don't say, okay, let's stop the test at 2 minutes, you could right away say, but the test is supposed to last 3 minutes. So where do you want me to go from here? So that they know you know that.
Okay.
Okay. And I don't think that they'll be, I don't want to say, I just want you to be prepared. I mean, I can't imagine that they would be that, tricky, but I do know that they're looking for, you saw the notes on that practical, the retired practical exam. They really want you to talk. They want you to keep talking until they hear what they need, and then they'll move on. And if they are asking you questions, it's probably because they haven't heard what they want to hear, what they're looking for. Okay?
Yep, sounds good.
All right. So the practical's when? Thursday for you guys? When is it?
Tomorrow.
Ooh, tomorrow. Okay. What time?
So each of us have a different time, but like 6 to 8 o'clock, depending on who it is.
Okay. What about the written? When do you guys take that?
Thursday.
Thursday.
Okay. I know it may seem like that there's a lot going on right now, but I would rather this scenario where everything's fresh, okay, and then just get it out there. All right. From what I'm seeing, based on the reviews, I think you guys are ready. What I noticed at the beginning of this review session was what I told you. I think some of the things were like that internal, external rotation versus eversion and inversion. I think that threw you guys because you guys were thinking about I&E. I think that some of the questions threw you because you weren't focusing on those primary words, and then really considering the 4 choices and do process of elimination. Okay, look at what can you eliminate? What do you know 100% doesn't make sense? And then it'll narrow you down to whatever 1 or 2, and then you can make an informed decision on which one you think is a better choice. And if you get down to the 2 and you're still not certain, go back and reread the question. Go back and extract what they're looking for. Look for those words, primary, things that just stick out that they're looking for. If there's a case study and they're not giving you a hell of a lot of information, don't look deep into it. Just look at the information that they're giving you. Okay, because you can't be expected, they can't hold you accountable for stuff that's not there. Okay, that one question, the only risk factor that person had after a pre-activity screening, so now we know, we went through the whole screening, that's the assumption. The only risk factor that person had was family history. That was how that question went. So look at those words that jump off the page and then go ahead and by deduction, determine what the correct answer is. So that's my advice on the written. The practical, know the steps inside and out, know every part of the practical that's on that practical review, the retired practical review, and don't be afraid to say too much, because if it fits within the scope of those tests, say everything and anything, and the examiner will stop you when they've heard what they want to hear. All right, if they're going to start asking you questions, it's probably because they're not hearing what they want to hear, and that might start to frazzle you a little bit.
Yeah, it's gonna frazzle me.
Okay. If it is, just tell the examiner, I just take a deep breath, just give me a second, I just want to regroup in my head. Listen, we've all taken tests. It's not like the person that's going to, that's administering this test is a robot and they don't know what it's like, to have test anxiety. We've all had it. All right, so if you need a second, take a deep breath, go back to your notes in your mind, and then, then respond. All right.
And we're not gonna do every single test, like not the Thomas test and the step test and the whatever. They're gonna pick a couple, or we're doing all of them?
Well, no, if you look at the test itself, the practice test that they gave you, there are the sections, it tells you, what they're going to be looking for in each. Like you have a choice, right?
There's like 2 assessments.
Okay. Yeah. So look back on that. Each category, there is a breakdown of what you're going to need to know.
I don't know if everybody got the email, but Jay sent an email earlier today with
Yeah.
more information on the practical testing. So
Okay,
it's in there as
Let's see if I
well.
got that.
okay. Yeah, look back at everything Jay has sent you, because, you know, he is the guru, so, he's been doing this for a long, long time, so, you know, whatever he states, you know, definitely focusing on, because, he's the one that knows best.
Okay.
He
All
sent
right.
it out today.
Yeah.
Yeah,
Oh,
just check your spam or junk, because sometimes it will go into that. I will pass your comment on about the video. So the videos in that email he sent you with the practical, was along with the document for the practical, retired practical exam, correct?
Yes, the videos were as links on the email.
Okay, and those links weren't for videos in Canvas or on the
No,
website?
they weren't on Canvas. It was just basically a guy walking through everybody, apparently people that have previously failed.
Oh, there weren't two videos on.
Two videos, yeah, one was assessments and one was muscular and flexibility, muscular endurance.
And he had a guy, he was in like his studio, and he had a guy, a kid.
Yeah.
Yes,
So wait a second, you're telling me that there was a discrepancy, because I put together, did you get a checklist from Jay?
he used a metronome in the push-up test. That was the question that we had about that one specifically.
Oh, interesting. Okay.
Yeah, because we were told that you don't use a metronome.
Yeah, for the push-up, it's for endurance push-up. Yeah, no, there's no, right, demonstrate the test on the score based on the maximum repetitions without rest. Terminate the test when the subject cannot perform another clean repetition. Right, yeah, no metronome. Okay, all right, so did Jay send you a checklist?
Today, I think that's what he sent today, right?
He sent a list today. I haven't gotten a chance to go through it, but yeah, he sent something today about the assessments.
Okay,
Yeah,
because
it's
I
like
had
a checklist.
yeah, I had asked him to send that, because that was something that I created based on, yeah, here it is. Based on the videos, but let's just
He
see.
sent today.
Push-up test. Yeah, so that's interesting, because did you get this?
Yes, today.
I didn't get it.
I need to look.
But it's here. It starts off with practice review checklist.
Yeah, that's what I'm looking at right now.
Okay, so if we go down to the push-up test, I put in here equipment none. And this was actually from those two videos. I created the list based on those videos.
I did that too.
Was that
Can
certain
you
that he
send me
had?
that? I put my email address in. Would you mind sending me a copy? Because I looked
Yeah,
in my junk.
okay, let me see. Okay. Yeah, I'm wondering if can I add stuff here? But yeah, I could send this to you.
Thank you.
Yeah, no worries. All right. Get it, and I'll send it to you right after we sign off.
Thank you.
Yeah, so that's interesting that it said it in the video, because like I said, I created this checklist based on those two videos. So I don't know why I must have, I don't know if I missed it or I corrected it. But I'll mention it to Jay, and then, or I'll just go back and take a quick look at that video again and see if it's in there, and then mention it to Jay. Okay, but at least now I have it narrowed down. All right, good. All right, any other questions, guys?
I don't think so.
All right. Guys, good luck. I really hope you do well on both of these, but just keep in mind, you know what, if you have to go back and repeat it, it's not the end of the world. I don't think I passed my first certification either. Very overwhelming. You know, but whatever you miss, you know, it's just going to make you stronger and a better trainer, because, you know, then you'll, you know, hopefully learn it as opposed to memorizing it. So I know you don't want to have to go through a test again, but just there's a lot of benefit to the practical because it's hands-on, okay? And that's what our industry is. So that's why it's so great that you guys decided on WITS as opposed to other certifications, because it's going to really set you apart in terms of your ability to be good personal trainers. All right. Definitely taking advantage of his internships too, right? Because you never know where that'll lead. You never know, it might end up with a job. And then, you can build your personal training practice from there.
Sounds great. Thank you for everything.
Oh, you're so welcome. Pleasure to work with you guys. And I'm looking forward to sharing this field with you guys.
Thank you. Thank you
All
so
right.
much.
Take care, guys. Have a great night and lots of luck.
All right, thanks so much.
Okay, bye-bye.
Bye-bye.
Thank you.
You're welcome. Bye-bye.
Bye.